Okay. So I've been a nurse for 16 years already. Okay. But I've really left the hospital industry since 2021 to start off my own business. So I run a medical concierge and medical tourism business, whereby I help clients in Singapore and also outside of Singapore with their medical conditions if they want a second opinion, and if they don't know which doctor to go and see and all that, I will direct them to the specific doctors that are specialized in their area, and that's the best for the patients. So in a way, it cuts down their time unnecessary to see unnecessary doctors. It cuts down their expenses as well, right? And if let's say they are going to use the insurance policy, so I always look through it and see what is actually the out-of-pocket expense that they have to pay, so they won't get shocked by the hospital bill, and if they don't have any money, that kind of thing. So yeah, that's what I do. So I take care of the whole process from start to finish. Even after that, I have my own physiotherapies and all that to ensure that they recover to the fullest potential.
I understand that you founded Project Helix. So
Yeah,
is this related to how you try to further help the patients?
correct. So why the name Project Helix? Because Helix, as you all know, is the DNA. So I want to be a part of your DNA in your medical journey. So wherever you go through your medical journey, I'm always there.
What was the most compelling reason that led you to choose this field?
Okay, so truth be told, I didn't plan to be a nurse from young, right? But when I took up nursing in my diploma days, so as I go for my attachments, every year we'll have attachments in the hospital. So I find that it gives me great satisfaction when when you see sick patients, right? And then they come in sick, but then you sort of nurture them back to health. And then you see that progress, you see that from sickness to health. I think that gives me the best satisfaction I can ever ask for, and when they say thank you before they leave the hospital, yeah, I mean, I think money can't buy that feeling, and that became my passion. And even right till now, I take it for myself to be very involved in all of my patients or my clients' medical journey and ensure that they get the best that I can offer. Yeah.
I think it's very heartening to hear about how much passion you have in helping your patients. Another question we have is, what is your day-to-day routine as an orthopedic nurse specialist?
So back in the day when I was in the hospital, so I worked closely with a lot of the orthopedic surgeons, because I was working in the orthopedic ward. So we work in a team. So my doctors, they will ask me also mostly what's best for this patient. How do you think the rehab is supposed to be, or what do you think the patient can do to do it better? So I work hand in hand very closely with the surgeons, in fact, to see whether is the surgery the best action for the patient, and even after the surgery, how's the rehab potential going to be like? What's the process like? And even before they go home, are they in the right environment to recover it? If they are not, then I'll refer to the specific people to see how can they continue their recovery at home, so that when they go home, sometimes some of these elderly patients, they stay alone, right? And if we do not see things, if we do not try to have a foresight and see, oh, if she's staying alone, she's still recovering from a leg fracture, she might not be able to attend to herself, be independent, she might fall again and something will happen again. So these are the things that I do on a daily basis and ensure that even in the hospital, they do not have any infections. Sometimes these elderly patients, they are kind of, after surgery, they're quite lazy, right? They're in pain, they don't want to sit down. So I'll be motivating them every day and explaining to them why movement is so important, even right after surgery. Yeah, so that's basically my day-to-day routine as an orthopedic nurse.
Can you describe your most challenging experience as an orthopedic nurse specialist?
Most challenging. Usually, most of the challenges usually come during my night shift. Because in the day, there's a lot of manpower, right? There's a lot of manpower. All the doctors are around, so it's easy to call for help. But at night, when the manpower is at its minimum and doctors are also only the on-call doctors, Since sometimes I have patients who get admitted at 2 and 3 a.m. and then they need to be hooked on a traction. Usually those people who have fallen down, have a hip fracture, so they need to be put on a traction, right? So, at 4 a.m. in the morning, you are sleepy and you don't have the manpower to assist you. So you kind of have to do 2 roles at once, because at the end of the day, it's in the patient's best interest, right? You have to be fast, you have to be quick. So I have this one particular patient so first of all, we need to put on a traction. And secondly, patient is demented. So she is very aggressive. She spits, she bites, she punches, So me and my colleague, we really had a very tough time to try to hold her. We need to hold her down, calm her down. At the same time, we don't have to move too much because it will affect the fracture worse. And I have to be on the other end to hook on the traction. So it's like just 3 nurses. It was quite tough. But then eventually I called the doctor. I said, doctor, you need to give her some first of all, painkillers to reduce the pain. Secondly, give her some sleeping mats so that she calms down and so that we can apply this traction properly, so that she can start to get the treatment as soon as possible. So initially, doctors were against it. They don't want to give her sleeping mats because she's already demented. So giving sleeping mats can further deteriorate the mental status. But I think this benefit outweighs the risk, right? So in the end, they did it. So it went on throughout the whole night until 7 a.m. until my shift was going to end. 3 hours. Yeah. So that was one of the most challenging encounters I had in regards to an orthopedic patient.
This definitely doesn't sound easy. So, how do you handle like the emotional and physical demands of the job?
I would say at the end of the day, if you have to know that you are, I always tell myself that these people's lives are in my hands. As a nurse, right? I'm the first line of defense for them, and I'm also the last line of defense for them. I always put myself in the patient's shoes, in the family shoes. Sometimes these patients, they're very demanding. The family members are so demanding. They are also emotional as well. And I take it upon myself that if my mom is in the hospital, I would be acting the same way. I'll be anxious. I'll be worried. I want things to get done fast. So I just see things very objectively. And if I get involved being emotional, then things won't get done. And because at the end of the day, that is my duty. That's my responsibility. But after the work ends, I don't bring those emotions back home. So it's always important to compartmentalize all this and just remember why you're doing this in the first place.
We would also like to know the opposite. What do you find most rewarding about your job?
Every day is a learning journey. Every day I learn something. And I don't know if you all watched shows like House or The Good Doctor. I like those shows whereby every day, if let's say I like to read up on the patient's blood reports, investigations, and all that. And I'll say, oh, why is the hemoglobin count low? Why is the white blood cells count low? So I challenge myself on a daily basis. Why is this happening to this patient, and how does it relate to everything else? Because to me, it's something that it's something that keeps me going every day, so that it's not mundane. I don't just like to go through mundane routines. And of course, on top of that, I improve my communication skills with all these patients. I have communicated with people who are less educated, more educated. So how I bring myself across and make different levels of people understand what I'm saying, that's also very, I think it has it has helped me become, because I'm also a part-time lecturer now, so it has helped to shape me to be a better educator to my students, whereby different people understand things differently, right? So I know how to cater to different kinds of people.
Can you describe your educational journey that took you to this job, or also your professional journey?
Okay, so in terms of educational journey, I didn't have quite a good education background, to be honest, because so I took my N levels and my O levels. Then I went for my diploma in Nanyang Poly. So in my first year, I really didn't make any sense out of all the studies. I repeated my whole first year, you know. So I hated the theory part, but I enjoyed the practical part. But then I told myself that if I want to continue doing what I like doing, which is the practical part, I have to ensure that my theory part also is at least I have to pass, you know. So that was how I thought of it at first. But then down the line, once I understand more about biology and all that, it makes it easier for me to study. So after my diploma, I took my advanced diploma in orthopedics. And then since I was already in the groove of studying, just 1 year later, I took my bachelor's in nursing. Then from then on, I took other small courses. Like I'm one of the few nurses in Singapore actually that is certified to do casting and spray painting. Uh, I went for a lot of conferences like wound conference, gerontology conferences, nursing conferences, because I like to keep up to date about what's happening now and also what's going to happen in the healthcare industry in the future, so that I can, not just for me, but it's also good knowledge for me to share with my fellow nurses, so that we all can always stay relevant. And I mean, now in this current day and age, there's AI, there's technology that's coming in, and a lot of people are afraid that their job will get taken over by AI. But I think if we understand how to use AI, it can actually benefit us in our jobs. And even though it will not totally replace nurses, but there are always benefits that we can leverage on. So even now, I'm still learning about how can I integrate technology into my expertise, my skills, to make the care for my patients better. Yeah. And right now, I'm also I'm a member of the International Society of Medical Tourism. So it helps. I'm learning about as simple as how do you stop travel diarrhea. I mean, I travel all the time and I always have diarrhea, and everybody around me who travels always have diarrhea. Uh, so actually, there's a reason for it. There's a reason behind it, and now I'm learning how to actually prevent it, so I can have a proper holiday rather than go to the toilet every time. Yeah.
So you mentioned in your previous response that you like the practical parts of your educational journey. Yeah, so can I ask, how did your training prepare you for the realities of working in healthcare?
Okay, I'll be honest. Actually, the 3 years of the diploma journey, it will never prepare you enough for the real world. Because I think as a student, you're still very well protected, right? You're protected by your school, by your lecturers, by your clinical instructors, by your preceptor, by your mentor. So you don't really see the full harsh truth until when you really put on the registered nurse uniform, and then you realize that, oh, this is it. There's no one for me to fall back on. Yes, I do have a senior nurse, but at the end of the day, these patients are under my care. I have to answer to them. Like when I was a student, anything the patient asked me, oh, hold on, let me call my staff nurse. You always have that card to play. But the moment you are the staff nurse, you cannot tell a patient, oh, I'm sorry, I'm just 1 month old. They won't buy that, right? So yes, it does prepare in terms of a skill, in terms of uh, I mean, it's about, I think they will prepare you about 40%, but the rest of it is really you really have to experience it when you have graduated. Then you really know the 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 what is at stake. Yeah, to understand fully.
Oh, so we have one last question.
Hmm.
Just do you have any advice you would give to students considering a career in healthcare or like specifically your type of career?
Okay. So, I mean, for students nowadays, even my own students, they see healthcare, being in the healthcare industry as a job that can give you security, it can give you stability, which I do agree. But what I've also seen is that if you do not have the passion and empathy for healthcare, you will not last. That's what I've seen over all these years. So for students who are looking to go into healthcare, I mean, I do encourage. I still feel it's a very noble job, right? Um, and to me, the skills that you learn in nursing, or in healthcare in general, you can apply it wherever you are, even at home, when you can identify certain things, identify red flags, it's good for yourself and your family and all. But if you don't have that passion to care for people, which means really going extra mile, sometimes you have to do the dirty aspects of the job. I mean, a lot of people, they say, oh, yeah, nurse just clean backside, change pampers. Yeah, that's part of it. But if you can't do this basic bedside nursing care, then you'll just drag yourself to work, and it won't last. Nursing is a physically and a mentally demanding job, I have to say. But if you have to look at it positively, you have to take it, and you must always have a goal to reach. If you see that goal that you want to grow as a person, nursing will really grow you personally and professionally. If you see the big picture.
Previously, you mentioned that nowadays with all this technology like AI that's coming up, how has technology changed the way you perform your job?
Okay.
And how do you stay updated with the latest developments and advancements in your field?
Okay. So in the hospital right now, there are, even like actually in Alexandra Hospital, started to use robots to serve medication, serve meal, So these are jobs that, I mean, you don't have to be a nurse to serve food, right? I mean, there are more better better things for you to do as a nurse. So in a way, the technology that is in place has taken away, yes, it has taken away some of the responsibilities of the nurse, but it's not what nursing is all about, right? And in terms of now, it's all the systems are in computer. You don't use paper anymore, so you don't have to worry about whether your handwriting is not nice, like your handwriting is um you don't or you can write properly. So it's all in the system, and you won't have any problem with losing the notes. So you know what everything is patient. So there are benefits to using technology, and how I keep myself up to date is, I mean, almost on a daily basis, I kind of read journals. I keep updating myself. Okay, what's the new? Let's say, for example, in orthopedics, right? So what is the new trend in orthopedics now? For let's say for a total knee replacement, what is the latest technology now that's happening? So I know what's happening. Now, if let's say a patient with a shoulder dislocation, a lot of people have shoulder dislocation. What's the best way? How does some countries deal with it? Because there's always some differences between how the Asian countries do it or the Western countries do it. So it gives me perspective from both sides so that I can advise my current clients now, hey, actually, there's not only one solution for you. There are a few solutions for you. Which one would you prefer? Some are less risky, some is less costly. So really, my clients, they have options, rather than, oh, I need to go for surgery, but I don't have enough money. So how? Right? So right now, if they say they don't have enough money, well, no problem. That's another option for you, even though it may not be as effective, but it fits your current budget. So it doesn't put a strain on.
Yeah, I think that's it for today. Thank you so much for coming down for this interview, and we really appreciate your responses and your advice.
Thank you for having me. Yeah, it's a pleasure. It's an honor to share my experience with all of you.